It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, I'm Sam Lesante. Thanks for joining us. And once again, we have a new doctor on the show. Well, she's not new to the area. She started in January. But I'll tell you, folks, the Greater Hazleton Health Alliance getting great doctors in this area. It's so exciting to see how our healthcare in this area keeps on improving. And I met someone last week, and I got to tell you a story about, we were talking about the doctors here and all the healthcare, and he said, Sammy, he said, I normally go out of town for my medical advice, and he said I needed particular surgery, and I took your advice and I checked this one particular surgeon in Hazleton, and I got to tell you, you're 100% right. We have great doctors in this area. There's no reason to go out of town, folks, and most of you already know that. However, I'm thrilled today because we have Dr. Manjit Singh, a pediatrician, and she joins my good friend Dr. Caggiano up there in the Alliance Medical Group, the Pediatric Services. We're going to talk about allergies and many other things. Now listen, folks, when you see this girl, you're going to think that she's just like in high school, but she's very matured and knows what she's doing. Hey, doctor, thanks for coming on the show.
Thank you for having me.
Manjit Singh.
Yes.
Yeah. Now, what nationality is that?
Indian.
Indian?
Mm-hmm.
Oh, that's
North
great.
Indian.
Yeah. And now you're a pediatrician, right?
Yes, I am.
Now, where are you from?
I'm from Savannah, Georgia. And
So you left Savannah, Georgia, a
Yes.
beautiful place, to come to another beautiful place, the Greater Hazleton area.
Yes.
Yeah. When did you go into medical school?
I started medical school in 2003,
Yeah.
and I went to Ross University School of Medicine, and then I did my residency in Savannah, Georgia, at Memorial Health University Medical Center, and now I'm here.
Now, let me ask you something, doctor. I always ask people why, they go into a profession, because I think if you're going to do anything in this life, you have to have a passion for it. No matter what you do, you have to have a passion. So you're in high school, you're in grade school. When did you decide, bingo, I want to become a doctor?
Honestly, ever since I can remember, I wanted to be a doctor, and my parents encouraged that thought, and that's the only thing I could think of becoming.
Seriously?
Seriously.
Are your parents doctors?
No, they're actually in business, but
Yeah.
they encouraged me to, I think they implanted the idea in my head a long time ago, and I just kind of
Do you have any
hung on
doctor
to it.
friends, or were you
Oh,
around?
yeah, exactly.
Yeah, were you around the medical profession?
I
mean-
was. I have cousins that are doctors.
Oh, yeah.
And,
And what, now what made you decide to go into pediatrics?
well, honestly, during medical school, I first thought I was going to go into internal medicine, and then pediatrics was my last rotation of medical school. And
Your last what, I'm sorry?
Last rotation, like
Okay,
clerkship
okay,
in
okay,
medical
so you do
school.
okay.
Yeah, and I loved it, and I just felt comfortable being around kids, and the pathology that you see with kids, it's fascinating.
It's interesting being a pediatrician because, kids, sometimes they can't tell you what's wrong.
Exactly.
It's like a
yeah.
veterinarian to a degree, not that
Yeah,
I'm comparing.
yeah, absolutely.
You have to just, from the symptoms and that stuff, and you really have to do. So you have to love kids. I love
You
kids.
have to.
Yeah.
Be a patient.
So you
person.
decided to become a pediatrician right when you went there, or was the last rotation that you said, I think I'm going to be a pediatrician?
Well, pretty much, yes. The rotation that I did, I really liked it, and
What do you like about it?
well, you get to go to work and be goofy. You don't have to be so serious. And
You should work here. See, I'm goofy. You see, if you want a part-time job, Melanie will give her a part-time job here. It's okay. In a good respect, because you get to see the kids, and so you like that the best, dealing with kids.
I do. I like that the best. And I remember going to the pediatrician as a kid, and I was so scared, and I think I've actually blocked it out of my memory. So just to make kids feel comfortable and be goofy with them, it's a...
Yeah, because I guess other than normal checkups, but if a child's sick, etc., they're nervous, and I know who's more nervous than the kid. That's the parent or the
Right,
guardian.
right.
They're a wreck, and so I guess I think sometimes. I know doctors are busy, and I want to tell you, we have a lot of great doctors here, as I say, but sometimes doctors forget the bedside manners. They're so tuned in to what they're doing that a little compassion sometimes, and I know they have a lot of patients they have to see, but a little compassion sometimes, a little smile, or just to break the ice a little bit is important. And thank God that the doctors I know are like that. Some of them are really funny, and you know what? With all the strains they have, it's, you know, you go into one patient who has a very serious problem, then you go into another one that maybe is, so you have to change, and it's not easy, but it's a difficult, I applaud you doctors, really. It's a difficult task, yeah. Do you ever find that sometimes it's draining for you?
It is. How you see one patient who, especially when you're in the hospital, who's pretty sick, and then you turn around and see a completely healthy kid, and
How do you handle, my wife's a registered nurse, okay, and she was in pediatrics, brilliant girl, she really knows her stuff, but the thing is, I don't know how and she's very compassionate, and just like a doctor, and how do you, take that emotions out of it, it must be a little difficult to take the emotions out of the, seeing a child who's sick, how do you do that? I mean, that's...
You just tell yourself, you think of the patient you're with at that time, and you focus on that patient one patient at a time, so.
Mm-hmm. Now, being a pediatrician up there at the Alliance Medical Group, which is the pediatric service there, folks, the phone number, let me give you a phone number up there, they give her a call, 501-6400, and it's the Alliance Medical Group, it's the pediatric services, and that's right next to the Wellness Center on Lions Drive. A lot of things happening right now, and we're in an allergy area, or excuse me, where the allergies are very high. Now, there's such a thing called rhinitis. What am I saying? Rhinitis.
Right.
Rhinitis?
Yes, rhinitis.
Am I saying that right?
Yes.
You give me a lot of big words to say here tonight. These people think I'm really intelligent when I say these big words. What is allergic rhinitis?
Another word for it is seasonal allergies, the annoying runny nose that we see, and the itchy eyes, and symptoms of allergies, basically. Seasonal.
So rhinitis is basically
the runny nose part of it.
The runny nose part of it, and comes from what?
Well, the things like pollen can trigger it, and especially in this time of the year, pollen season. Pollen's pretty high, and that's one of the triggers for it.
So how do you? What is the epidemiology of the allergic? The question is, what is the epidemiology of allergic rhinitis? Folks, big words I'm saying here tonight. I'm telling you. Epidemiology.
Yes.
My wife will be able to tell me exactly what that is.
Well,
what is it?
It's the incidence of the disease, how often it occurs, and what percentage of the population it occurs in. But with allergic rhinitis, the epidemiology for kids, it's about 40% of kids are affected with this. And it usually starts at around 5 years of age. It's kind of uncommon under 2 years of age, but the prevalence increases as age 2 on.
And so if your child has runny nose or itchy eyes and watering, what should you do? Is there anything you give them before they come to see you, or?
Well, you could try over-the-counter allergy medicines, and those are usually FDA approved for 2 and above, 2 years of age and above.
Is that a good thing, though?
It doesn't hurt.
Yeah, but I mean, if your child is constantly have running noses or running nose, itchy eyes, or it's certainly best to come to you and
definitely.
Get a. So so my child has a runny nose, he's itchy eyes. I bring him to you. What do you do?
Well, with your physical exam, you can see certain symptoms that shout out allergies. Kids will have these dark circles underneath their eyes, which are called allergic shiners, and that's caused by the venous congestion underneath the eyes. They also have these little wrinkles underneath their eyes, which are not because the kids are old, but they're called Denny Morgan lines, which are associated with allergies. And then another classic thing the kid will have is a nasal salute from all the sniffing. They'll keep rubbing their nose upwards, so you'll see a little crease on the nose. And when you examine inside the nose, you'll see the mucosa inside. It could be pale or red and puffy looking. Yeah.
So now, what are the risk factors here?
Risk factors, genetics does play a big role. If there's genetic history of the parents or other family members having allergies, or any type of eczema, it does increase the risk. Being born in high pollen season is another risk factor. Maternal smoking is another risk factor.
What's that?
Maternal smoking, if mom smokes or if anybody smokes
So
in the
if
house.
they're smoking in the house, which,
Yes.
I'm totally against smoking. Some people don't like me because I say that. But I think, I don't think sometimes people, a mother and father or families are always concerned about the health and welfare of their children.
Mm-hmm.
But in the same token, they'll smoke in the house.
Yeah, it's just appalling.
Or they'll smoke in the car with the kids in the car, not realizing what the secondhand smoke does. And if you said, I'm going to give your kids some poison, they'd shoot you in the head. But however, in the same token, they're actually, to me, they're poisoning their kids throughout. Little babies in a home. When I walk into any place and I see people smoking and there's a baby in a home, I say to them, are you insane? Are you really insane doing
It's a
this to you?
shame.
I mean, what does that do to a kid with all the smoke in the house or in the car?
Secondhand smoke exposure, it puts the kid at risk for things like, especially an infant, a baby, for sudden infant death syndrome. They have more infections, like ear infections and things like that, if the parents smoke in the house. And it's important to know, even if we do go outside and smoke, we still bring in smoke inside the house with our clothes, our hair. So these are other risk factors.
Yeah, and so now sometimes, I harp on this all the time about smoking. It just breaks. I get so upset when I see these things happening. But anyway, that's probably none of my business. As one girl told me, it's none of your business what I do. I said, okay, fine, but you have a little child, and I'm concerned about your child. If you're a knucklehead to do that, that's fine. But I just think it's wrong. Anyway, if you let it go, okay, if you said, I'll give them pills, it's okay, and what could eventually happen if you don't treat that child with the running nose and the itch, give them over the counter, that seems not be, and you don't want to take them to the doctor or her to the doctor, what could happen?
Well, it has complications and other associated conditions with allergies. Sinusitis kind of goes hand in hand with it. And then things like if they have asthma, this could worsen their asthma. It's a trigger that can give them more asthma attacks. And then just things like that, which are complications.
Major things could happen now correct me if I'm wrong, can major things happen if you don't pay attention to this?
Well, things like infections, ear infections, because these kids that have allergies, they have fluid built up in their eustachian tubes, and that could sit around and cause ear infections and things like that.
So getting back to, I'm always into the preventative, prevention of something. The most important thing is that you should be taking your child for a yearly examination.
Definitely.
Okay, so when you go for a yearly examination, that's where the doctor could check a lot of things, okay?
Right.
And you could see the symptoms or maybe the start of these things coming in.
Definitely.
It's a lot better, don't you think, Doc?
Yes, definitely.
So you could see that coming and you could say, well, look, I would prescribe this or
Especially
whatever.
coming into a season like this with a high pollen count. Yes, definitely.
Folks, if you just tuned in, I'm talking to Dr. Manjit Singh. Have I said that right? Dr. Manjit Singh?
Yes.
Pediatrician, and she's up there in the Hazleton Alliance Medical Group, which is the pediatric services, for 501-6400, folks. It's very important, I think, that you should take your children for at least a yearly exam, particularly if they have any of these symptoms of rhinitis, which is allergies. What are the signs and symptoms again of?
Some of the signs and symptoms, of course, the runny nose usually starts off clear, but it can get yellow and green. And then
Not a pretty picture.
yeah, it's not. And then the dark eye circles underneath the eyes, and the little wrinkles that we talked about, the Denny Morgan lines, and then the nasal salute. They have this little crease up on the nose. So those are
So
some
that's
of the
part of
signs
your
and symptoms.
diagnosis,
Yes.
right?
Yes.
Okay.
But
Now,
you could do other skin prick tests and the skin prick test that can help determine what the child is actually allergic to. And
yeah, I was telling you about my allergy. Whatever happened, my tongue
right.
swelled up.
And blood tests too.
Yeah, well, I took the blood test and that stuff, but I guess it would be, now, not that we want to scare people, okay? I guess it's the degree of when the person comes in. You know, you may be able to diagnose what it is, and the runny nose, and give them a prescription. If it becomes more serious, then I think you have to go into the blood work, etc. So maybe maybe
or even refer to a allergy specialist at that
and that
time.
would be the degree of what you see.
Exactly.
Okay. All right. Now let me ask you this. Let's go back to prevention. Okay. So I take my child every year for exam, and I know that my child may have itchy eyes at one point. If I take him into exam and you begin to check my child and say, I think we should do this. I detect this. Could that prevent when you prescribe going into a more serious situation?
Yes, definitely.
Okay, that's what I'm trying to get at. Is the fact is, don't wait till it's really bad, particularly if it starts. You should be seeing you immediately. Okay.
Yes.
Nothing that it's ultra serious, but it can lean into something more difficult than what you had
Well, it
before.
also affects the quality of life, and allergic rhinitis, it does cause impairment with sleep, and kids, they usually have the postnasal drip at night and cough at night, and that disturbs their sleep, and that makes them fatigued, and it could affect school work performance, and things like even cognitive function impairment. ADHD is something that can kind of...
What's that?
ADHD, attention deficit.
Okay. All right.
That can also kind of be sparked up by this, because the kids are wired up and not getting their rest at night, so they're wired up during the day, running around, hyper.
Is it contagious? If you're playing with a child and their nose is dripping and their eyes
No, allergies, they're not contagious.
Okay, I just was curious. Kids play together and there's a kid's nose is dripping, his eyes are red, and
Yeah, it's not contagious.
Parents get nervous and say, "What do you have?" What's the treatment?
Well, avoidance of trigger would be one option, but
What's that?
Avoidance of the trigger, which is usually pollen, would be one option.
Why do you do
but
that when you're outside?
Exactly. So you start off with medical therapy.
What's medical therapy? What do you do?
We could start with first generation and second generation antihistamines. First generations are usually sedating, things like Benadryl, so we usually tend to start with the second generations like Claritin and Allegra and Zyrtec. And these things, they're not sedating, so the kids can take it during the day and go to school, and it could help with their symptoms. If it's just mild. If it's a little more severe, you could do nose sprays, nasal sprays like Flonase or Nasonex, things that there are advertisements on TV for these medications. They help. It's an inhaled corticosteroid, so it helps decrease the inflammation in the nose, so that helps. And then there's also immunotherapy, where you can send the patient to the allergist, and that's when they do their series of blood work and see what the patient's allergic to, and give them their immunotherapy shots.
But I think, I know sometimes interim, for example, if something happens Friday and, your doctors are not in until Monday or whatever, okay, in interim you maybe give them something over the counter, etc. But I think at any time you should definitely get to a doctor.
Oh, definitely.
Because, the gamble with, over the counter and all this other kind of stuff, and the Benadryl or the, and say, well, there's the child, they have children's Benadryl now, right? I mean,
yes, they do.
I think it's, it's always play it safe. It could be absolutely nothing. It could be minor, but it's always good to address that before you get into something serious.
Right, definitely.
What are the associated conditions and complications, did you say?
We talked about sinusitis and associated conditions, eczema, that's something that kind of goes with this. This could trigger your asthma and make it worse. Otitis media, ear infections, those are some complications of allergic rhinitis.
Now, I asked you this before, and I'm going to repeat some questions, because sometimes people go through the channels and they stop and they see me and they say, we got to stop and watch Sammy. Then they see a pretty girl like you, and they definitely have to listen to the thing. But we're talking about allergic rhinitis.
Rhinitis.
Rhinitis. Why do I keep saying that? Rhinitis. What's that name?
Rhinitis.
Rhinitis, okay. And what is that again?
Allergies. Rhinitis is a runny nose, basically.
So why do you give me these hard words to say? Why don't you say what are the allergies? You give me all these hard words, and people say, Sammy can't even say rhinitis.
I apologize.
Okay. I'm only kidding you. So they're allergies,
Yes.
and they could be any kind. What about rashes on your you get a rash on your leg, your face, or something develops again? What should you do then? Could be an allergy, right?
Could be an allergy, like contact dermatitis, if they've touched something that's provoked a allergy attack.
What are some of the preventive measures?
Well, basically it's in the high pollen season, you could make sure you change your clothes when you come inside the house so you're not bringing pollen inside. Frequently washing your bed sheets, because we take a lot of pollen to bed with us, and showering on a daily basis would be a good thing also. So those are the type of things that
Allergies are crazy, aren't they?
they are.
I mean, like what my situation, I mean, like, something triggers it where, something happens to my tongue. But I mean, the point is that, it's hard to figure out sometimes,
Right.
So if something's happening, there are a series of tests that you try to find out what it is.
Yeah, definitely.
Okay. What's the most difficult allergy that you encounter? Is there something that, where it's really difficult to
Well, something like the tongue starts swelling up, or if they're really allergic to something and it provokes like a bronchospasm where the airway closes, and that's a pretty serious thing. And for that, you should definitely go to the hospital and go to the emergency room at that point if that's happening.
And again, something happens that there's allergic something that happens in your, and what happens? Allergies attack certain parts of your body?
Yes, certain cells that, like your body basically kind of tries to, I can't explain it.
Get rid of them?
Yes.
Okay, all right. I ask these hard questions because I want to know. See, I get an education when I bring doctors on the show. So you diagnose these, okay, by coming to you, and then you do a series of tests. And what do you do again if my child's nose is running, or I'm scratching my eyes, or whatever?
Well, I mean, it's a clinical diagnosis, as well as if it's a severe one, then you can do blood tests and figure out, or even the skin prick test and figure out what exactly they're allergic to, and kind of.
So each different season brings certain things. For example, you don't have that many allergies when it's wintertime. Okay, so when it comes into the spring and summer is when you begin to see.
You see mostly tree pollen season at that time. During August, September, you'll see ragweed season around that time. So.
Could it be
pollen.
Could it be in the food sometimes you eat?
Yeah, if you're allergic to some sort of food, for example, if you're allergic to shrimp, that could, but that's a little separate from allergic rhinitis.
Yeah. So this basically is with the children's with the runny noses and the
Yes.
itchy eyes, etc. So if you combat that early, you have an opportunity. Rule of thumb for children: when you, of course, after you have a child, your child's being examined, but now the child's maybe 1 or 2 or 3 years old. How often should you think you should be taking your child to a pediatrician?
Well, it's under 2. We see kids more frequently. Like say, if a baby will come as a newborn, then 1 month, 2 month, 4 month, 6 month, and then until they're 2, we see them a little more frequently. But after 2, it's more on a yearly basis, unless the child is sick.
How important is family history?
Very important.
Okay, because for example, if you have a history of certain things in your family, and now with the advances that we have in medicine, I guess that's why it's so important to know what your mom or your dad, or grandmother has. That's important.
Yes, very important.
And you compile that information, and then maybe watch that person.
Well, some diseases are genetic, so if
What diseases are genetic?
Well, things like.
Did I ask you a hard question?
Yeah. Well, I can't think of it right now.
No, but is it like, cancer?
Cancer is genetic. Diabetes is genetic,
genetic?
especially if it's type 1 diabetes. People are more prone to it. Hypertension and heart disease, these things are genetic.
Okay, well that's what I'm saying. So I mean, I don't want people saying, oh my God, my grandfather had diabetes, now I have it, or my child could get it. I mean, but it's good to know that, so then you can monitor these things.
Yes,
correct?
definitely. say if there's an obese child that we see, and obesity can lead into diabetes, the type 2 part, and if there's family history of type 2 diabetes, then it makes them more prone to getting it. So.
And that's another thing where I think when you see young children who are obese, it's not a good thing.
No, it's not. It's an epidemic, unfortunately.
Yeah. And why is that, do you think?
Well, I think TV as a babysitter and video games and the type of diet we have. And then on top of that, it does kind of have a genetic component to it also.
Yeah, but sometimes when you're talking about, diets and stuff like that, I think it's nutrition sometimes. I know today society is very different. When I grew up, we had dinner, we were at the dinner table every night, which is a good thing because at least you were able to have a family get together. And sometimes people today wonder what's going on in the world. Well, they don't even get together with their families anymore, or they're always running here, running there, running there, and all of a sudden they're dead. So I don't know what they're trying to achieve, but the point is that it's still it's important to try to at least pay attention to your children as to what nutrition they're having, what they're doing. Okay, and in general, allergies are high right now in the season. Dr. Manjit Singh, folks, she's a pediatrician. A lot that you can learn, particularly if your child is having some runny nose or some issues. But the most important thing is, when was your child to the doctor last? Now, let's assume a child's 12, 13, 14 years old. What ages do you cover up to? 16?
21, actually.
Up to 21. So, okay, so now sometimes, when they're in junior high school, they figured, well, they're infallible. They don't need to go to the doctor.
Well, usually around adolescence, you do see a little absence of them coming to the office.
But is that a good thing?
No, I think every year, a yearly checkup it's preventative medicine, so it's definitely good.
And I think that's what happens. Sometimes, you're healthy and you figure, well, nothing can happen to me, and it's in that kind of situation. But it's really great to know that we have people like you into the area. Why did you decide to come to Hazleton?
Well, I like New York City, and this location is very accessible to all these big cities, and when I came here to interview, I loved it. I mean, I love the people, and I'm glad I made this decision.
You're in a great area. These are a lot of great people in northeastern Pennsylvania. I'm a native here. I'm very proud. I could have been in California. I could have been anywhere with the TV station, and we decided to stay in with our hometown. So I wish you the best, Doctor.
Thank you very much.
Okay, and tell my friend Dr. Caggiano I said hello, okay?
I will.
He's another great guy. Folks, Dr. Manjit Singh, pediatrician, 501-6400. Folks, we have great doctors here. Now, for those of you who are smoking in the house with children or in the car, do me a favor. Don't smoke around your children. If you want to kill yourself and smoke outside, that's another thing. But do not smoke. It is not good for you. Right, doctor? Help me out here.
Absolutely.
Okay, good. That's medical advice. We'll see you next time on the Sam Lesante Show.